Now that you've finished up chapter 7 and 8, you're ready for the midterm. So I wanted to put together this video with some midterm study tips, some tips for test anxiety, and some more information about the medical assessment you'll be doing. So just a reminder, the midterm is going to be 100 multiple choice questions. It's going to cover everything we've done so far. So chapters 1 through 23, including those chapters in 7, 8 that we snuck in there at the end. The questions on the midterm are very similar to what you've been doing on the quizzes. They're not the exact same questions. You won't see any repeats. But if you've been scoring in the 70s on the quizzes or higher, you should be okay on the midterm. The midterm, you want to get a 70% to pass. We'll talk a little bit more about what it means to pass or not pass later in this video. The other part of the midterm is going to be the medical assessment. If you're in the in-person class, we'll do that during the midterm on the same day in person. So you don't really need to do much to prepare. Just make sure you're ready to do a medical assessment. Bring your blood pressure cuff and stethoscope to class, as well as a watch so you can check vitals during your assessment. Online students, you'll need to record a medical assessment, a video of you doing one before the midterm, and we'll talk more about this later in the video. You do not have to check vitals since most of you have not had a chance to pick up your blood pressure cuff and stethoscopes yet. You'll get those when you come in for skills at the end of the class. So some study tips for the midterm. I mentioned these earlier, but just to reiterate, the first thing you want to study is your quiz reflections. And by that, I don't mean just go back and read the questions that you missed. I mean the reflections that you wrote where you said, oh, I need to remember that a pulmonary embolism is a blood clot, but pulmonary edema is fluid buildup in the lungs. Or, oh, oops, I forgot about scene safety. That's always first. If PPE is an option, it's probably going to be the best answer, and those kind of things. So go back through those. If you haven't been doing quiz reflections, you're going to be have a little bit of an issue studying for the midterm, but I would probably start with going back to the first quiz and try to get through as many quiz reflections as you can between now and the midterm. It's just the best way to study because it's the stuff you didn't know when you took your quizzes. After you've gotten through your quiz reflections, any note cards that you've made. So vocabulary words or things like the Glasgow Coma Scale, maybe you made note cards for. Go back and study the ones you've made or make some new ones if you haven't. As you're doing your quiz reflections, if there's something you don't know, make a note card for it. Guided notes workbook, again, that's something that I put together because it's the stuff I think you really need to know the most. It's the things you need to study. It's not busy work. If it's busy work, I would have made it a lot bigger. I just tried to keep it to the most important topics of the class. So, have a friend read a question, see if you can just answer it cold, have them just turn to a random page and ask you a question. You should be able to pretty much from memory answer almost every question in the workbook. So study that if you haven't. And then make sure the workbook is actually completed as well up through chapters 23. That's, admission to the midterm is going to be completing that workbook, at least up to the chapters 23. And then go back to your textbook. If there's any chapters you didn't get a chance to read, or maybe you skimmed them, or maybe you did read them, but then you really struggled on the quiz, go back and just read the chapter start to finish. If you're at a loss for which chapters to study, I would say probably the most important ones are going to be chapter 10, where we learned about all the airway stuff. Chapter 14 is a really good overview because it talks about just all the different medical emergencies we learned and how to do a medical assessment. Same thing with chapter 9. It's going to give you a lot of good clues on your medical assessment. If you're having trouble with the medical assessment and what questions you should be asking, chapter 9 will be great. And then chapters 13 on are all pretty important. So whichever quizzes you had the most trouble with, I would go back and read those. And then there is at the end of each chapter in your textbook, there's a little quiz. I think they call it the assessment in action questions. To find the answers to those, remember at the beginning of the class, I said you could go on to the JB Learning website, log in, go to the chapter, and you can find the answers there. But also a former student recently in the Google Drive, he actually sent answers to all those questions. So if you want the answers to those assessment and action questions, you can go log into the class, scroll down to the very bottom where you'll see the link to the Google Drive with all of our class resources, class materials, Google Drive. In here, under right here in the main folder, you will see answers to assessment and action quizzes at the end of the chapter. So like I said, a student put this whole thing together for you. So he copied and pasted it, and there's all the answers in one spot. So if you want to study those, that's where you can get all the answers the easiest way. Also here in the Google Drive, notice in the main folder, there is a midterm review video down here at the bottom. and there's a midterm review PowerPoint. So the PowerPoint was used to make the video. And this is a review that Matt did for some of his students that were in a group he was helping out a while ago. So that's a really good review if you're wanting an actual video to go back and study for that review. So those are the big study tips for the midterm. When you're actually taking the midterm, when it's the day of and you're sitting down there taking the midterm, this is what I would do as you come to each question. This is just how I do it. If you have something that works for you, go for it. But if you're struggling with the quizzes and stuff like that, I think this is my recommendation, at least for how you should approach each question you come up to on the quiz. So the first thing you want to do is just read the whole question start to finish, not the answers, just the actual question. Just read it once through, no stress. Just kind of read the whole thing to get a big picture of what's going on. Then immediately go right back up to the beginning of the question and read the whole thing again, this time going a little slower and taking note of anything important in the question. Maybe you notice that some vitals were a little bit high or a little bit low, or you notice signs of airway problems, or you notice something that was an issue to scene safety. Anything like that that is kind of a red flag, just maybe jot it down on a piece of scrap paper. You are allowed to have a piece of blank scrap paper for the midterm, so you can write stuff like that down. Then again, before you look at those answers, think, what do you think the correct answer to the question might be? Just think about what do you think they're looking for here? So once you have kind of an idea of the right answer in mind, now you can go look at the answer choices. Even if you see your answer there immediately, still make sure you go ahead and read the other options. You never know if they might have snuck in a scene safety or a PPE answer choice there that would actually come before what you were thinking. So read through all the options. At this point, if you have the answer down, you can skip down to number 5. But let's say you've read the question twice, you've read all the answer choices, and you're still not sure. Well, now you want to go back and just focus just on the answer choices. Sometimes the answer choices can be really long, so read each of them start to finish. Eliminate any answers that are blatantly wrong. Maybe there's just one little piece of it that's wrong. I remember from one of the quizzes, there's a person who they can't have nitroglycerin because they've taken Viagra within the last 72 hours. Well, remember we said they can have it as long as they haven't had Viagra within the last 24 to 48 hours. So even though it says 72 hours, it makes you want to pick that answer, because you know they can't take nitro if they've already had erectile dysfunction medications, but it's 72 hours instead of 48. So it's wrong. It's blatantly wrong. It shouldn't say 72. It should say 24 to 48. So cross that answer out, let it go. Don't even read it again. You're done. Try to do that to at least 2 of the answers. Now you're narrowed down to the 2 best answers, or maybe you're narrowed down to the 1 best answer. At that point, you're not finished. Mark your answer or write down on a piece of paper, it's either A or B, and then go back and read the question the whole thing start to finish again, just to make sure you didn't miss anything. And especially this time, focus your attention on what the question's asking. And that's usually going to be the very last few words of the question. It'll be sentences, and then there's a question. What would you do? Or what's the best answer, or whatever. What is that question actually asking? You'll commonly see repeated these 3 types of questions asked. They're asking, the most common one is probably the one I put in the middle here. It'll say, you should, what should you do? And really they're asking, what should you do first? And this is a good time to think back to your medical assessment. What comes first on the medical assessment? What would I do first? The other types of questions you might see, they might ask, what would be the definitive treatment for this patient? And these throw students off a lot, because definitive treatment is not necessarily inside your scope of practice. For example, we had a question about a patient with a high blood sugar level or a high blood glucose reading. And the question was, what was the definitive treatment for this patient? Well, if they have high blood sugar, they need insulin. That's not in our scope of practice, but that was actually the correct answer, because it asked what was the definitive treatment. I know there was another question with a patient who had a tension pneumothorax. And the question was, what was the definitive treatment? Well, it's a needle decompression of that tension pneumothorax. But neither of those things are inside of our scope of practice, not a needle decompression and not insulin, but those are the definitive treatments. So it could be the right answer, even if it's not in our scope of practice, if the question's asking for the definitive treatment for that patient. And then the other common type of question you'll come across is where they're trying to get you to diagnose a patient. And I know these are one of the ones that are the most difficult for students, because we've learned about so many different medical conditions. The best thing you can do to prepare for this is really to have a bunch of note cards with all those different medical conditions and all those key indicators, sharp pain, coughing up blood, trouble breathing. pulmonary embolism. Trouble breathing, we can hear fluid in the lungs. Well, that's mostly likely pulmonary edema. Things like that, where you can, just what are those key indicators of those medical conditions? But in the moment when you're at the test, if you're not really sure and you're trying to pick between two, a good strategy is actually pick the one that's the most life-threatening. If you're thinking, well, it could be possible, it could be, one of the two. Pick the one that's the most life-threatening, and you're more likely to be correct. Okay. And then my last piece of advice is just go with your gut. Do not change your answers. On the midterm, you will be able to go back and go through questions you weren't sure about, but I really do not recommend doing that. I would just go start to finish straight through the test. If you go back and start changing your answers, overall, most students, their grade starts to drop as they do that. So go with your gut. If you're unsure of the answer, go with the one that you thought of first. If you feel yourself starting to go down these rabbit holes of, well, what if, and you start thinking about scenarios and picturing different things, do not do that. Don't let yourself go down that path. Just go with that first gut instinct. As soon as you hear your brain say, what if, just stop right there. If it's not stated in the question, don't assume it. Only assume. You can't assume anything. So only believe what's true if it's written in the question. Don't let your mind wander. Okay, a lot of students come to me and they say, Danielle, I have a lot of test anxiety. I just don't really, what do you recommend? Well, some tips that I've given students over the past have helped them is that there's no time limit. And the same is true for the final exam. And even when you get to the national registry, they give you 2 hours. It is extremely rare for students to run out of time on any of these exams. On my exams, there's no time limit. On the national registry, it's just extremely rare for you to run out of 2 hours because you'll have less questions than my final, most likely. But anyway, so there's no time limit, so don't feel rushed. Remember, the worst that's going to happen is you're going to get a bad score, and you're going to at least know, hey, here's what I need to study. Okay. If you're in the middle of the exam and all of a sudden you feel yourself becoming anxious, you feel your palms sweating, your mind's racing, you can't focus. Okay, it's time to take a step back. These are just some things that I've honestly just read on the internet that I'm repeating back to you. I'm not an expert on this stuff. If any of you are experts and have better tips for me to pass along to students, please let me know and I'll do that. But some things that worked for people in the past, right in the moment, just try some meditative type breathing exercises. A common one you'll see is just inhale for a count of 2 seconds and then exhale for 6 seconds. Maybe do that 5 times just to kind of slow your heart rate down and calm yourself down. From the EMT perspective, it's kind of interesting what test anxiety is, because it's just your body releasing adrenaline or epinephrine. So it's speeding up your heart rate and it's basically getting you ready for battle. And the battle here is the midterm, and having a fast heart rate and sweaty palms is not going to help you one bit. So try to calm yourself down and remind yourself that really, nothing bad can happen from this exam. All it is just a moment to see where you're at. Another tip is kind of just reboot. Just get up and walk around for a minute. If you're doing the midterm online, just kind of send me a message and let me know, hey, I'm stepping away for a minute. That's totally fine. Another tip that works for a lot of people is this 5, 4, 3, 2, 1 method, where you notice 5 things that you can see around you, 4 things that you can touch, 3 things that you can hear, 2 things you can smell, and 1 thing you can taste. This is just a good way to kind of ground yourself really quickly and bring you back to the moment, get you away from the test and kind of reboot. So again, there's no time limit. So take however much time you need to do these things during the test to kind of calm yourself down. If you're taking the midterm from home, make sure you have a quiet place to take the midterm. Let your housemates know, hey, I'm going to be doing a midterm. It's 100 questions. It's probably going to just tell them 2 hours. If you need anything, I'll be available in 2 hours, but for the next 2 hours, I really need silence. Lock yourself in a room or something, just so you can have full attention focused on this midterm. So it's really good to know exactly where you're at and not have other things distracting you. All right, moving on to the medical assessment. So remember, for the medical assessment, you're allowed 15 minutes. Now, if you're in the online class and you're not going to be checking the pulse, respiratory rate, and blood pressure during the assessment, you should really try to finish it in 10 minutes, because that extra 5 minutes you'll need when you're actually having to take that time to check the pulse, resp rate, and blood pressure. Now, you cannot use notes on the medical assessment. You need to do it from scratch. Don't be looking at your medical assessment sheet or have anything written down. You can have a blank piece of paper for the medical assessment. So if you want to take a blank piece of paper with you, if you're doing this on video, just show me at the beginning that your paper's blank, and you can write things down. That way, when you go to give your run report at the end of the assessment, you can go back and look at the things that you learned during your assessment. If you're in the in-person class, you'll get feedback right as soon as you finish your medical assessment. If you're in the online class, you're going to email me your video of you doing a recorded video of you doing a medical assessment, and then I'll get back to you within a couple of days. Those of you that are in the in-person class, if you would rather record yourself doing your medical assessment so you don't have to be interrupted in the middle of your midterm, you can absolutely do that. Just do that before our midterm and I will grade it and get it back to you. Okay, for your recorded medical assessment, anybody can be your patient, but you do need an actual patient. You need a second person there to actually ask the questions to and have them answer your questions. Don't worry, I'm not grading your patient if they're giving you off the wall answers or being silly or whatever. It's no big deal. I'm just looking for you to ask the right questions. And I'm not even listening to what they're saying back to you, to be honest. A lot of students will do this during their weekly Zoom meetings with their group, and they'll just record this, use the feature to record the meeting during the Zoom meeting. That works just fine. You can record it on your phone, your laptop, whatever. Once you get your video recorded, a lot of students try to email or text it to me and it's just too big of a file and it won't go through. It's never worked so far. So it's not going to work. Let me just tell you. So upload it to YouTube and have the settings as unlisted. If you set it to private, then I can't open the link because I'm not added as a person on there. So put it unlisted. And the only way anybody can get that video is if they have your link. They can't search it and find it if it's unlisted. So put it to unlisted, email me the link, or if you want to go famous on YouTube, you can put it as public and see who finds it. For the scenario that you use, you can use any medical scenario that you want. You can make things up if you want. Or remember, you can also go to those medical scenarios that are in the Google Drive folder. So again, the Google Drive folder down at the bottom of the class, we have our class materials Google Drive folder. And then to get those medical assessment scenarios, that's going to be inside the NREMT skills folder. And you have the medical assessment scenarios. And these are the ones expanded by a student. Again, a student added some information to make that a little easier for your patient to have all the answers to the questions that you might ask. Okay, that's all I have for you. I hope you're feeling ready for the midterm. I hope you do well in the midterm. And if you don't, and you're not sure what to do, reach out to me and we'll get you up to speed so you can get through the final exam. So I hope this helps and I'll see you all soon.